Hey, it's Chris Beyer.
Chris Boling.
Hey, CB. Good morning.
Good morning to you.
We've got an extra guest I'm excited to have with us, not just on screen, but live with you. You want to make an introduction to Miss Kari?
We have a special guest.
All right.
We do have a special guest, which would be my lovely spouse, Kari.
Good morning.
And
Morning,
we are
Kari.
celebrating American Heart Month. So Kari's wore red for Go Red for Women.
Very good.
And this month is a special month for us. Unfortunately, it has touched us both personally.
Yes.
I lost my father at a very young age from a heart attack. And Kari had an event 3 years ago. Is that right?
2000, December of 18.
I remember that. Yes. So Kari, you'll talk a little bit about what you went through, but your background, you've worked in healthcare yourself for quite some time, right?
Yes, I'm an RN. I've been in cardiology my entire career, which has been long. I won't say the year and date myself. But yeah, I've done cardiology my whole career. I work in a cardiology office currently. So yeah, I have had a lot of experience in the cardiac world. And then all of a sudden, in December of 2018, I became a survivor and a cardiac patient, which was a little bit crazy. You certainly don't think that's going to happen to you at 48 years old, but we know that heart disease is the #1 killer of women.
Yes.
And yeah, so it happened to me, and I try to talk to people about it, encourage people to really, listen to their bodies and talk to your provider and make good, healthy choices. And February being Heart Month is a great time to highlight that. So it's fun to be on with you guys, and never done that before. So
That's all right. It's our first adventure of having a joint camera on one side. This is
yeah, I know. I try not to move because it pops me out of the screen.
So Kari, with you working in healthcare as an RN, and I think such an awesome career. I know my grandma worked multiple different floors, but did a lot of work in cardiac nursing. I remember that when I was a little kid. So I mean, I got a special spot in my heart for that role. When you're working in that space and you're working with patients, what did you not notice or not experience for you all of a sudden to have a big event? Was there anything that you could have done to prepare better to know that, or was it just so sudden you had no control?
It wasn't sudden. My symptoms were really strange. I mean, there's kind of two different areas there's lots of different areas of cardiology.
Yeah.
But there's kind of plumbing issues and there's electrical issues, right? So mine was an electrical issue. I had an issue with how my heart beat, the electrical system that sends a signal for my heart to contract. I didn't have like a heart attack or a clogging of the arteries kind of issue. I had it on the electrical side. So my symptoms were really vague. It's a condition they really don't know why or how or what exactly happened to cause it. But I had symptoms on and off through my whole life. I just didn't know how to put the verbiage to it. So I think what I could have done differently is really pursued my symptoms more. I talked to my healthcare provider, but I wasn't able to put the words to exactly what my symptoms were. And I just thought, okay, maybe it's menopause. Maybe I'm tired. Maybe I'm lazy. Maybe I need to just kind of buck up and do what everybody else does. But mine was a lot of fatigue, a lot of dizziness, just not feeling well. And what was happening was they think my heartbeat was probably like in the 20s at times. And when I was sleeping, my heart rate would go down. I would have big, long pauses where my heart wouldn't beat at all, which is finally what happened the day I had the event. I was super dizzy. I passed out multiple times, ended up finally went to the hospital because Chris was like, we're going to the emergency room. This is crazy. I thought maybe I had like an inner ear infection. Again, I'm a cardiology nurse, right? So I just kept blowing it off because I didn't really think it could happen to me, and went to the emergency room, and my heart stopped multiple times in the emergency room. The next day after I was admitted, they called a code blue. My heart stopped beating for 39 seconds. I woke up and they were doing chest compressions and they're like, you're getting a pacemaker. And I was like, you gotta be freaking kidding me. This is insane. Why do I need a pacemaker? But and women have different symptoms. Even if we go and look at like the traditional, when you think of heart issues, you think of heart attacks and that kind of thing. For so long, women their symptoms have been a little bit ignored. We think of the classic symptoms for men of my jaw hurts, my left arm aches, I have chest pain. women's symptoms can be really, really different, and men too. But I've heard of people saying like, my teeth hurt, I'm so tired, I have a burning. So there's different things. So I think the big thing is just to continue with your checkups, talk to your healthcare provider, tell them your symptoms, listen to your body. I don't feel well, I'm so fatigued, I have no energy, things like that we really need to promote. And then if you hear a friend or your mom or your sister saying, gosh, I don't feel good, or these kind of things are happening, encourage everybody to talk to their healthcare provider and listen to yourselves and believe yourself. I just didn't believe my body. I just thought it couldn't happen to me, and I was kind of being a baby about it.
Yeah.
And
Trying to ignore it and minimize it.
Absolutely. Right? Yep. Absolutely.
I think that's an important piece. I know, Chris, you and I have been talking about, wellness and making sure that we're doing our annual checkups and taking care of ourselves, especially coming into a spot where we haven't had regular checkups as available as possible. And I think, Kari, what you said, it's really good to listen to your body, have a good relationship with your doctor, and even somebody like you who deals with heart-related situations as a profession, to know that you didn't recognize it means that any little thing could probably be something to discuss with your doctor, no matter how minimal it might seem.
Absolutely. Absolutely.
I'm glad we can celebrate with you. I know 3 years in and you're doing well. That's big. I mean,
yeah,
this is a great month to be able to celebrate that and to recognize you as a survivor, and also just be able to share the message of what needs to be a consideration, especially here in the month of February.
Absolutely. Absolutely. I appreciate you having me, guys. You guys
Yeah.
have fun. And oops, I'm out.
Don't move.
Don't move. One more little plug, if I could do, is everybody should know CPR. Learn CPR, even watch some YouTube videos.
Yes.
Learn CPR. It's, even if you can do a little bit just to kind of know how to help people, it's really big. Hopefully you'll never have to use it, but if you do, having a little education behind you and be able to help somebody is a really big thing.
Well said. Well said. Thank you, Kari. Thank you, Chris.
Gary.
All right.